Good evening, class. My name is Cindy Morse, and I'm here with you tonight to discuss the importance of professional socialization and how to develop that as you become a nursing student. Okay, let's look at the learning objectives. Upon completion of the learning activity, the nursing student we're going to discuss the definition of professional socialization. And in that discussion, we're going to describe the importance of the professional socialization to the nursing education. We're going to develop a clear understanding of why activities foster professional socialization while identifying factors to facilitate professional role development that leads to professional socialization. Finally, we're going to demonstrate ideas to incorporate professional socialization into your nursing education. Nursing education is going to provide nursing students with the skills and knowledge that they need to become beginning practitioners, according to Etheridge in 2007. Etheridge continues to discuss in 2007 the importance of clinical judgment that is needed to ensure patient safety. Further, the theory and the clinical experiences that are needed to learn how to be a nurse are provided in your nursing education. Socialization. Socialization is defined as a process that people learn roles, values, and statuses that are necessary to participate in social institutions. Of course, this is a lifelong process, and it's going to change. It's going to change as people grow older, as we join new groups, as we take on different responsibilities, as you'll see as you go from student to student nurse to a graduate nurse, as you learn new norms, because you're going to learn how to be a nurse. And you redefine your own self-concept. As you go through your nursing program, you will redefine your own self-concept. You will no longer be the same person that you were when you started this program. Okay, so now we've talked a little bit about nursing education and socialization, but now how does that come together to really talk in terms of professional socialization? So let's talk a little bit about what professional socialization is defined as. It's defined as a development of personal identity to fulfill a professional role. So you acquire this professional socialization through knowledge and skills, maybe a change in attitudes or beliefs or values, adopting norms, learning new ethical standards. All of these skills will teach you what is expected in your new role as a graduate nurse. So let's talk about some examples of professional socialization that are positive. So as a nursing student, you can demonstrate professional socialization in your role as a nursing student through respecting instructors, following directions, whether it be from an instructor or perhaps in a clinical setting, being prompt, making sure you're not late, treating others with respect of your fellow students, the nurses, the doctors, the patients that you are in the hospital delivering care to. As nursing instructors, you should see that your nursing instructors are also setting examples of professional socialization through arriving on time, respecting the students, following the dress code. They should be demonstrating care toward patients and students and fellow nurses and doctors that is very appropriate, very respectful. And the way that your nursing instructors handle interactions with fellow nurses, the doctors, students, all of these interactions should always remain professional. So that way you're getting a good role model of how to make sure that your interactions remain professional. Okay, so anytime we talk about positive, there's always a negative to look at. So let's look at some negative examples of professional socialization. Students can demonstrate negative examples of professional socializations through being disrespectful, not only to other students and the staff, but also in the medical setting, whether it be the doctor, the nurse, or the patient they're giving care to. If the students are not on time, if the students do not follow directions, and again, we talk a little bit more about this disrespectful treatment of staff, patients, nurses, and doctors. The instructors can also demonstrate negative examples of professional socialization through not following a dress code, treating students with disrespect, not only maybe that's belittling them in front of a group of people or even on a one-on-one basis, or possibly just, treating them very rudely, treating the staff and the doctors and patients disrespectful. So it's really important to build those relationships to make sure we all work together as a team. If the instructor's not on time, and if the instructor demonstrates rude acts, not only verbally, but if they actually carry out rude acts toward their students, those are all negative examples of professional socialization. So what's actually going on with student nurses? Are they really understanding their role, their new role, and how that professional socialization might actually come into play? Nursing students are feeling very overwhelmed. They have a lack of understanding of their new role as a nurse. They're not quite understanding how this new role demands them to be as professional as the profession of nursing is demanding us to be. Non-traditional and traditional nursing students lack an understanding of the shared learning experiences needed for success. They're not thinking about what's going on with the student and faculty relationships and how important those relationships are. They're not thinking about the friendships, the caring connections, the shared learning, all the collaboration that has to occur in order for nursing students to build a strong foundation in their studies so that they can go on and be a professional nurse later on in their career. Now that we've talked about nursing and nursing students and what professional socialization is, how is that important to nursing? How can we tie professional socialization into the art of nursing? And really, if you think about it, professional socialization is going to affect the care that's provided to the patients. Because remember, that has to do with how respectful you are to your patients, how you treat them. There's certain changes that have to occur in order to ensure that the care that they are getting is very non-judgmental. The professional socialization is going to affect the ability for the nurse to cope with their own nursing role. They need to realize that as time progresses, their thoughts and their beliefs cannot actually lessen the care that's offered to the patients. The nurses need to learn how to effectively cope with the daily pressures of the role of nursing to improve the care that is actually provided to the patients. All this has to do with that professional socialization transformation that has to occur to make sure that the patients, ultimately, that's why we're all nurses, so that the patients get the best care possible. Therefore, you have to be polite, you have to be nice, you have to think about everything we've taught you. It just all has to fall together, kind of like a puzzle. Now, how can we go further and actually facilitate a professional role development? As instructors, we can role model this to our students, not only through the patient care that we give, but also through all the interactions that we have with our students and anyone else that we might actually have interactions with. Students can actually facilitate a professional role development through bonding experiences that they seek, whether it be with friends or family or patients or other staff members. They really need to focus on the relationships that they're building. Each student is also learning in a group environment, not only in the classroom, but in a clinical setting. They're getting some group shared learning. They're seeing some role modeling of information. They're seeing some role modeling of behaviors that are positive and negative, and we're learning from each one of those situations that happen. And of course, anytime we have any kind of a caring relationship where you are giving of yourself, that is how you're actually facilitating this professional role development. And what should students notice about faculty and what they're doing to promote professional socialization? The first thing that faculty should always think about is the role model of which they are giving to each student that is with them. Their students are learning from everything that they actually do. They're watching, they're taking notes, they're paying attention to what that professor or instructor or faculty member is doing. So it's really important for us to remember to be good role models. Another thing that a faculty member can do to promote professional socialization is utilization of case studies and interactive class assignments. So really facilitating teamwork in the classroom so that students have the opportunity to learn from each other. They're learning to build this professional socialization in the classroom that they can carry on to them with them in later on in life. And what can you do as a student to promote professional socialization? You really need to seek a bonding experience with other students, not only in the class and the clinical settings, but also in the laboratory experience or laboratory environments that we have, any kind of simulation exercises that you are actually participating in. There's a lot of learning that occurs when you share that learning in a group. Encourage your friends as you seek encouragement from your friends. So, we go back to that old golden rule. You treat others the way that you'd like to be treated, regardless of how they're treating you. Share transportation to and from school, clinical settings, or work. That gives you a little bit of social time. It gives you a little bit of time to blow off some steam. Your fellow students understand what you're going through, where your family and your friends just may not, because they're not going through it with you. If you study in groups, again, you each learn off each other's behaviors, and you learn to grow as students and then, of course, as graduate nurses. And of course, if you prepare your assignments early, that always helps you. It helps keep you from being stressed and pressured, and it could keep your mood and you much calmer. And it's easier said than done at times, but if you just prepare your assignments early and be on time with things, it really takes a lot of the stress and pressure that might actually push you into having a negative impact on your professional socialization. So as a wrap up, remember to take control of your learning and be responsible for your own actions. Be aware of the actions of the people around you. You're going to want to learn from the good examples, and you can learn from the bad examples, but then please try to avoid those bad examples. You're going to see some bad examples. You just have to take them as a learning opportunity and realize that that's not the way you want to treat people that are around you. Remember that nursing is a profession that demands a high level of honesty, integrity, and ethical treatments to others. We all get into it because we want to honestly take care of patients, or at least that's what I always want to think. Remember to enjoy your new role as a nurse and develop the skills you need to be an excellent graduate nurse. And then as your career in nursing progresses, you will just continue to bloom and flourish. Please feel free to contact me if you have any further questions. Thank you for your attention and your time.